Good evening, Professor Carlson. My name is Sarah Uko. I'm here to present Perinatal Depression Readiness Program. Introduction. Perinatal depression is a disorder that affects women during pregnancy and sometimes to the postpartum period. 1 in 7 women have depression and are a common complication of pregnancy. Perinatal depression has a short-term or long-term effects on mothers and children. Perinatal depression is a treatable medical condition in which individuals complain of sadness, indifferences in mood, and changes in sleeping patterns. Factors that lead to perinatal depression include social demographic characteristics, ethnicity and cultural background, marital status, and employment status, area of residency. Background. Depression is a significant cause of disability for people of all ages and affects 264 million individuals in the US. Depression leads to individual increased health costs and leads to frequent hospitalization. Perinatal depression occurs during pregnancy and 4 weeks after childbirth and can last for about a year. Significance of study. The finding from this study will help the nurse identify patient symptoms of depression. The significance of this study is to identify the causes of perinatal depression and a systemic approach in helping nurses who care for patients with prenatal depression receive appropriate intervention. The finding from this study also will help to increase skills as evidenced by post-implementation assessment and reports by nurses. Project objectives and aims. This project aims to ensure that nurses will identify depression symptoms by using assessment tools such as Edinburgh's postnatal depression scales and refer women with positive symptoms of depression and at-risk women to providers for early intervention and to follow the US Preventive Services Task Force guidelines. Project objective and aims continue. At the completion of this project, nurses will verbalize understanding of screening for perinatal depression. Research and clinical question hypothesis. Does educating nursing staff on perinatal depression increase their knowledge about depression, perinatal depression? Empirical literature. Perinatal depression is when women experience significant emotional turmoil, and about 10 to 15% of women experience moderate to severe depressive symptoms. The US Preventive Services Task Force et al. Reported that perinatal depression affects 1 in 7 women in one of the common pregnancy complications and the postpartum period. The predisposing factor for perinatal depression includes when women with a history of depression, stressful life events, younger women, and demographic variables. However, study shows that the most vulnerable population for women to develop depression is the postpartum period. Recent studies show an increased rate in the development of perinatal depression during pregnancy. Most of the depressive symptoms start during pregnancy, necessitating the need for early intervention. Supporting literature. Out of the 25 articles that met the study's criteria, 9 met the criteria for the effectiveness of perinatal preventive measures. Research Field 2007 researched the risk factor and intervention effects for the patient with perinatal depression, and reported that interpersonal psychotherapy, peer support, massage therapy, yoga, tai chi, aerobic exercise, and parenting education programs help reduce symptoms of perinatal depression. Felder 2019 reported the benefits of counseling and intervention. 39% of women who receive interventional therapy said a reduction in the symptoms of perinatal depression, and the most appropriate counseling intervention for perinatal depression is cognitive therapy and interpersonal psychotherapy. Theoretical concept framework. The theoretical framework suitable for this SPP is self-efficacy theory by Bandura. Bandura is an American-Canadian psychologist. In his own words, and I quote, "The original concept was that self-efficacy is a personal judgment of, quote, how well one can execute courses action required to deal with situation. Self-efficacy is a set of beliefs that determine how well an individual can execute a plan of action in each situation. Successful intervention for perinatal women focus on the STEP knowledge and depression and its effects on pregnant women." Philosophical assumptions. The self-efficacy theory by Bandura is the model for my project and explained that empowerment is increasing self-efficacy, knowledge, and competency that comes from working towards self-determination and meeting the goals. Women with strong support system reported having increased ability to parent and increased self-efficacy level linked to fewer perinatal depression. Provider competency and insights, level of competency, assessment of broader range of risk factor, and developing provider relationship with mothers can improve treatment outcomes. Moreover, providers who practice patient-centered care are likely to have a better alliances, leading to improved treatment outcome. The Iowa model is a model in various clinical settings, and it aids in translating research finding into clinical practice. This is the evidence-based model. Since the Iowa model entails examining variables in advancing healthcare, it is an essential model to manage perinatal depression. The Iowa model is continuously used to analyze the advancement and outcomes of variables that enhance advocacy for practice change. The Iowa model encouraged the identification of the problem and triggers where an evidence-based model can be applied. Project methods. There's no specification on sample selection to determine how large the sample should be. Polite and Beck 2020 suggested that it is better to use a large sample size as possible. A sample is a subject of population. Convenience sampling is a standard form of qualitative sampling. People are invited to participate in the study because they are available regardless of access, location, time, and willingness to participate. Convenience sampling is considered a fast and easy way to achieve the sampling size needed for the study. Mozzatti 2020 described convenience sampling as accidental or opportunity sampling, which involves picking any available individual to participate in the study at the research site. Convenience sampling is the intended sampling method for this SPP because it is faster and easy to achieve the sampling size needed for the study. Project design. Continue. Research involved a strategic plan and procedures needed during a study to address the research question and measure to protect the integrity of the study to reach a valid conclusion. It is essential to pay attention to participant selection. According to Moran et al. 2020, there are several methods in which a DNP project is conducted, such as quality improvement, policy evaluation, translating evidence-based practice, clinical or practice-based inquiry, healthcare policy, and generating new knowledge. Most importantly, the design used depend on the clinical questions, the availability of subjects and time frame, the researcher's skills, ethical factors, and the availability of resources. Project question. My project question is, does educating nursing staff providers on perinatal depression increases their knowledge about perinatal depression? Sampling and setting. According to Polite and Beck 2021, setting is a physical location of an individual. In a study, it is the location in which collection of data takes place. The proposed setting for this project is a university teaching hospital located in North New Jersey. It is a magnet hospital and accredited by Joint Commission. The study will occur in women's health clinics where perinatal and postnatal women meet for follow-up care. It is an outpatient clinic that operates from 8 a.m. and closes at 5 p.m. The proposed setting is for this project, as I said before, is University Teaching Hospital located in Northern New Jersey. Informed consent. Informed consent is commonly used in research and medicine, especially when it involves human study. It is the framework of protection in which human subjects in research is built. The legal decision on informed consent began in 1905 when a surgeon changed the surgery plan from the right ear to the left ear, noticing that the right ear is not affected by the disease without the woman's consent led to a lawsuit. For this reason came the concept of informed consent in early 20th century. Research variables. The study variables include demographic dependent variables and independent variables. Demographic variables include age, years of practice as a nurse, especially at the clinic, educational level, practice license, and role. Measurable variables in the study are perinatal depression education, depression knowledge, and perinatal depression confidence. Independent variable in the perinatal is the perinatal depression education program, while dependent variables are perinatal depression confidence score using Banduro's self-efficacy score. Tools. Plan for data collection. A survey for data collection is appropriate for this study because the project measures variables perinatal depression knowledge and depression. According to Polite and Beck, a survey is a non-experimental research process that involves gathering information about people, activities, beliefs, preferences, and attitudes via direct questioning. The project will require intellectual statistics software to analyze the data. A t-test will analyze variables such as the survey and years of experience and age. First and foremost, a consent form is needed and demographic survey and pre-survey will be provided to participants. The intervention process will occur in person during the clinic session, following CDC guidelines for safety due to pandemics. The study will involve descriptive method of analysis, the data, According to Jacobson, descriptive statistics is a statistic that describes the characteristics of data such as means and proportions. Ross and Zaidi 2019 state that limitation is a form of weakness within a research design, and it is possible to influence the outcome and conclusion of the research. There are limitations regardless of the researcher format, such as qualitative research to clinical trials. Reporting a study limitation is an essential part of research process. According to Ross and Zaidi in 2019, presenting study limitation is an ethical element of scientific inquiry. The study anticipated limitation would be a non-licensed personnel exclusion from the study. Thank you for listening. This is not the end of my PowerPoint presentation. As we go on in the study, other part of my SPP will be added, and we'll be able to do this presentation again some other time. Again, I say thank you and looking forward to meeting with you tomorrow by 7 p.m. Thanks.